Welcome into News Channel 11 at 5:30. I'm Josh Smith. Sarah will rejoin us in a moment, and many of you know who this is. This is one of the leaders in our region in terms of dealing with COVID-19, Ballad Health Chief Infection Prevention Officer Jamie Swift. Jamie, thanks for joining us again at 5 for Asking the Experts. We appreciate it.
Thank you.
Let's first talk about what you're seeing within your hospitals and what you're seeing in terms of health department trends. We've been on what seemed to be a slow downward trend in terms of new cases. What's the latest?
We're continuing to see our downward trend. So, the daily cases that we're working seem to be going down. We've kind of hovered around a little under 100 cases right now of patients admitted. So I think we're still going down. It's still certainly important to keep doing the things we're doing to get that even lower. We don't want to maintain right here.
What about in terms of death rates, and those are the cases that you're seeing coming to your hospitals with real serious illnesses? Have you seen any marked change in that on that front?
We're still seeing deaths, obviously. I think we're getting hopefully to that kind of 2 weeks behind where we thought we might kind of peak out at our deaths. So I'm hope to see those start coming down within the next few days.
In the past few weeks and months, you have been using social media to reach out to not only people in your circle of connections, but also Ballad Health doing the same thing to try to get the word out about what you consider to be misinformation about COVID-19. And recently you took on some of the conspiracy theories. One of them that you labeled as misinformation was this idea that this year the flu might be worse than even COVID-19. And from the start, I know you've been saying this is not flu, but you made a point of saying that flu is not as bad as COVID-19. Help me understand that and help our viewers understand. What do you mean by that?
So really what we're seeing, flu is, if you know me, you know that I talk about flu every single year. Flu is extremely important. I'm extremely passionate about preventing flu, just as I am with COVID-19. I think there's been a lot of people who want to say COVID-19 is no worse than the flu. What we know so far is that, annually, flu causes about 30 to 60,000 deaths a year in the United States, and that varies year by year, obviously. What we've seen is we're already over almost 189,000 deaths from COVID-19 in the U.S. in 7 months. So, they're both respiratory diseases. They're both very severe, but by far, COVID has been the deadliest infectious disease that we've seen in over a century.
You've also been using every platform you could find to deal with the question of whether or not deaths are being overreported, that people who are dying with COVID-19 are being leveled as deaths because of COVID-19. What's your message on that?
Again, it's really up to that treating physician who knows that patient and has known the course of illness. And if you're walking around and you have diabetes, yes, you're more at risk if you get COVID-19. But we know if you come in and you have these chronic health conditions and you have COVID-19, COVID-19 is what caused that death. There's usually multiple things listed on a death certificate. So there's no one who's incentivized to over-report deaths. Again, nationally, the feel in the science world is that deaths are probably underreported.
Have you been surprised by the level of mistrust that you have seen in the midst of all this?
I have been. I mean, I've said a few times, I've trained for 20 years of my life now for a pandemic. So this has been in my vocabulary. We've done multiple trainings and exercises, and it was always about when a pandemic would occur in my lifetime, not if. But I was really never prepared for the just complete rejection of science and the data at times.
Today, United States Congressman Phil Rowe, a retired physician, told me that he thinks we could see a vaccine enter into the market by November. And he was hopeful that there would be widespread by the first of the year deployment of a vaccine. What are you hearing at Ballad Health about development of a vaccine and maybe when it could be administered in our community?
We're keeping a close eye on that. So we've got a team within our Corporate Emergency Operations Center that is dedicated strictly to staying on top of the information related to vaccines that are coming out, to review the science as those come out, to make sure they've gone through the appropriate trials and all the things that we need to know, because what we want to do is make sure that we can, with good faith, ensure our community that the vaccine that's coming out is safe and one that we want to encourage everyone to use, and we're confident it will be.
So, I'm thinking in terms of you've got flu season coming, you're trying to get people to vaccinate for flu now, right? I mean, that can be happening now. If you did get a vaccine by November to December, could you see a situation in which you were literally trying to vaccinate people for both flu and COVID around the same time? And does that give you concern?
I think we can handle whatever comes. So certainly we're ramping up flu vaccine. September, October is really when people need to get vaccinated. So want to encourage people, go get that flu vaccine. There's a lot of information around COVID-19. There's still a lot that needs to be done in those trials. Certainly the CDC said, get your plans together. I can tell you with H1N1, we got our plans together long before we had vaccines. So we're hopeful it will come out. We're ready when it comes out. I do believe it will come out with prioritized groups that need to get it first, just like they did with the H1N1 vaccine that year. So I think, we'll be able to handle it. We'll be ready to respond and go with whatever the government and the vaccine makers have for us that's available.
30 seconds left. We have schools now moving toward, it seems, more in-person learning, gradually in that direction. Are you seeing anything that makes you wish they would go back in the other direction toward online learning?
I think, certainly a lot of schools are trying it. I think we can. I think as long as schools and teachers and superintendents and school boards really have the plans in place and those plans are enforced and social distancing and masking and hand hygiene and all those things are in place, I think we can see what happens.
Jamie Swift with Ballot Health, thank you very much for your time again today. We appreciate it.